On this video, I'm going to be showing you how to complete a standard note. So we are going to go to the scheduled visit of 323. Okay, and it pulls up the detail page. This is where you'll put any mileage you might have gotten. The visit type, it can be changed here as well. It's going to be standard for now. Under the action, we have completed on paper, reschedule visit with communication report. We're going to select the PT progress note. Okay, and then we're going to hit continue or proceed, the green button. Okay, and then it pulls up all the patient information that was on the referral. We're going to hit next. Okay, and then it's going to pull up your subjective part of the note. At every visit, we should always ask if the patient had any recent falls, any new wounds, any hospital stays, or any new meds since the last visit. And that's where the subjective is where you will want to document that, as well as other things such as patient has an illness or something that stands out about that patient that day would need to go in the subjective. So once that's filled out, you'll hit next. Okay, another thing that needs to be checked every visit is heart rate, blood pressure, and respirations, and O2 levels also if there's a doctor's order. The heart rate, blood pressure, and respirations will be put right here. Once that's filled out, you'll hit next. Okay, another area that always needs to be addressed is asking if the patient is in any pain and getting their pain level. So up here at the checkbox, you can hit yes or no if they were in pain. We'll select yes. There's two options. You can use the pain rating scale, which is the most popular, or you could use the FACE scale. We're going to change it right here to the 0 to 10 scale. And then I'll ask you intensity. We'll put 5. And then it goes into more detail about that. The local location, onset, frequency, etc. Once all that's filled out, you'll hit next. Okay, and it's going to ask you if the medication has changed. Okay, equipment assessment. This will be whatever equipment y'all may have used during treatment. Okay, gait mobility training. If you're PT or if you have an OT goal that has to do with this will be where you'll put how many feet they ambulated and with or without an assisted device. Or if it's not applicable, we'll check that button. And then hit the next key. Okay, and here's muscle strength and range of motion evaluation. Here's a balance section. It's a lot of drop down boxes, so that makes it pretty fast and easy. Transfers. Okay, and then we have the exercises that is on this patient's record. We can go in and put how long that they held those, if you worked on those, and then we'll hit next. Okay, and the instructions you gave them while performing those. Wound care, if you did any wound care. Prosthetics. Standardized test box. Okay, objective, this will be anything that you've done during therapy. Any kind of exercises, level of assistance that the patient required will all be right here. So all that's filled in, you'll hit next. Go to goal assessment. We have to be sure that we go in and select the goals and the percentage. We found that if you don't actually go in and click on these and then hit next, it will not print out on the standard note when the home health agency tries to go in and print. So you have to go in here and put the percentage down for these goals so they will be seen. So we're going to hit next. Okay, rehab potential. You can change good for stated goals, excellent for stated goals. Any additional information? Assessment, patient tolerated and is benefiting from skilled PT. Under additional information, you could put patient would continue to benefit from skilled PT to improve weakness and functional mobility. To get it more specific, we'll hit next. Coordination of care. This is if you talk to the PT or the assistant, you would put that here. Okay, plan discharge at end of plan of care, or if that patient was given a 5-day, you would note that right here. And the plan for any additional information, if you're an assistant, you will need to put continue with plan of care as supervised by whoever your supervisor is. We'll hit next. Okay, and then it's going to ask you for your time of your visit. So you'd fill all that out and hit next. Okay, and it's going to ask you for your signature. You can either, if you have the option to sign here, you could sign there, or you can capture it outside a system. Okay, and as also with the therapist signature, it can be captured outside of the system as well if you need to. And then the date will be outside of the system. And this is the spot for any additional forms that you may need. Okay, and then it's going to pull up your note for you to check over to be sure that everything's there. It looks like our goal is on there, so we're going to hit finalize. And there you have it. That's how you complete a standard note.